Hi, welcome to the explanatory video for the Testing Shop's Food Intolerance Panel. In this video, we'll walk you through the Food Intolerance Panel, a genetic assessment designed to provide relevant insights into how a patient's body may respond to specific food components.
By analyzing key SNPs through our validated polygenic risk score, or PRS, algorithm, this report helps identify genetic predispositions to common food intolerances, allergies, and sensitivities. Each category outlines not only the risk classification, but also explains the potential clinical implications and how these genetic tendencies may impact digestive health, immune function, and energy levels. The report is organized into three major categories: food allergy, food intolerance, and food sensitivity. We begin with food allergy, which provides valuable insight into a patient's genetic predisposition to immune-mediated responses triggered by specific food proteins. This section examines susceptibility to peanut allergy, milk allergy, and egg allergy, all of which may contribute to hypersensitivity reactions ranging from mild dermatologic symptoms to life-threatening anaphylaxis.
Understanding these risks allows clinicians to develop prevention-focused care plans, improve dietary guidance, and mitigate potential emergency events. The first subcategory is peanut allergy, one of the most clinically significant food allergies due to its association with severe anaphylactic reactions.
If the patient's report indicates a high or medium genetic predisposition, it suggests an elevated likelihood of IgE sensitization to peanut proteins. These patients may be more prone to immediate hypersensitivity reactions, ranging from cutaneous hives and abdominal discomfort to life-threatening anaphylaxis. In such cases, complete peanut avoidance is advised, along with education on identifying hidden peanut derivatives in processed foods and preventing cross-contamination. A low-risk result indicates a lower genetic likelihood of peanut allergy. While strict avoidance may not be required, continued clinical monitoring is still recommended, particularly in pediatric patients or those with other atopic conditions.
Next, we examine milk allergy, which results from hypersensitivity to proteins such as casein and beta-lactoglobulin found in cow's milk.
For patients with a high or medium genetic risk, dairy exposure may trigger allergic reactions such as eczema, vomiting, respiratory symptoms, or intestinal inflammation. In these cases, a dairy elimination protocol is advisable, with careful attention to replacing calcium and vitamin D-rich foods. If the patient shows a low genetic risk, their immune system is less likely to mount an allergic response to dairy. However, tolerance should still be confirmed clinically, especially in children or in patients with overlapping food intolerances.
The final subcategory under food allergy is egg allergy. Sensitivity to egg proteins, particularly those found in egg whites, is a common early life allergy that may persist into adulthood.
A high or medium risk result suggests difficulty tolerating egg proteins, with symptoms ranging from skin rashes and nasal congestion to digestive upset or wheezing. These patients benefit from avoiding eggs and egg-containing products, including processed foods with ingredients such as albumin or lysozyme. If the patient has a low genetic risk, eggs are generally well tolerated. Nevertheless, symptom monitoring remains important, particularly in cases of unexplained inflammatory or allergic responses. Let's now move to the second major category: food intolerance. This category explores genetic predisposition to difficulty digesting certain food components, primarily due to enzyme deficiencies or metabolic inefficiencies. It focuses on traits such as gluten intolerance and lactose intolerance, both of which can influence digestive comfort and systemic health over time.
We begin with gluten intolerance, a critical trait evaluated under this category.
Gluten intolerance, also known as celiac disease in its severe form, is an autoimmune reaction triggered by gluten, a protein found in wheat, barley, and rye. It can cause damage to the small intestine, leading to nutrient malabsorption, chronic inflammation, digestive discomfort, and broader systemic health concerns. If the patient's report shows a high genetic risk, they are more likely to experience symptoms such as bloating, abdominal pain, and fatigue when consuming gluten-containing foods. In these cases, a strict gluten-free diet is strongly advised to protect gut integrity and prevent long-term complications. A medium genetic risk suggests moderate susceptibility, where reducing gluten intake may help manage symptoms, particularly if digestive discomfort is present. A low genetic risk indicates minimal likelihood of gluten intolerance, and gluten can generally be consumed unless clinical symptoms suggest otherwise.
Next is lactose intolerance, which occurs when there is a deficiency of the lactase enzyme responsible for breaking down lactose, the natural sugar found in dairy products.
If the patient's report shows a high genetic risk, it indicates a strong predisposition to lactase deficiency. These individuals are more likely to experience significant digestive discomfort and may develop secondary inflammatory responses if dairy intake continues. In such cases, a dairy elimination strategy using lactose-free alternatives is strongly advised. A low genetic risk suggests efficient lactase production and a low likelihood of lactose-related intolerance. However, ongoing clinical monitoring remains important, especially if digestive symptoms or inflammatory markers emerge over time. The final category is food sensitivity. Unlike food allergies or intolerances, food sensitivities do not involve a full immune response, but they can still cause significant symptoms such as headaches, fatigue, digestive discomfort, and disrupted sleep. Genetic factors influence how efficiently the body metabolizes certain compounds, and sensitivity can vary greatly between individuals. Within this category, the panel evaluates caffeine sensitivity. This trait reflects how quickly or slowly an individual metabolizes caffeine and influences energy levels, anxiety risk, cardiovascular response, and sleep quality. A high genetic risk suggests slower caffeine metabolism, where even small amounts may trigger side effects such as jitters, anxiety, elevated heart rate, and insomnia. A medium genetic risk indicates that moderate caffeine intake may be tolerated, though symptoms like restlessness, sleep disruption, or mild palpitations may occur, especially at higher doses or when consumed later in the day. A low genetic risk suggests efficient caffeine metabolism, with fewer adverse effects from standard intake, although excessive consumption may still negatively affect sleep or stress levels. The report also includes supplement considerations such as vitamin D3, calcium, probiotics, magnesium, and omega-3 fatty acids, which may provide additional support in managing food intolerances, sensitivities, and allergies when clinically appropriate.
In summary, the Food Intolerance Panel offers valuable insights to help clinicians better understand a patient's genetic predispositions to common intolerances, sensitivities, and immune-mediated food reactions. By identifying genetic risks early, such as lactose intolerance, gluten sensitivity, or food allergies, healthcare professionals can guide more personalized dietary interventions, recommend appropriate supportive supplements, and implement proactive monitoring strategies. Leveraging these genetic insights allows clinicians to move beyond generalized dietary advice and deliver targeted, precision-based care that improves digestive health, reduces symptom burden, and supports long-term patient outcomes.